Hi, PA Kendall. I'm a 50-year-old patient, and understand that you've recommended a colonoscopy as part of a colon cancer screening. However, I have some concerns and reservations about undergoing that procedure. Can we discuss maybe some alternatives and the risks and benefits associated with it? Certainly, I appreciate your concerns. Colonoscopy is actually considered the gold standard for colon cancer screening because it allows us for a direct visualization of the entire colon and the removal of any precancerous polyps that we might find during that. It provides us the most comprehensive assessment. However, there are some alternative screening options that might be suitable for you. What are some of those alternatives? One such alternative is a stool-based test called the fecal immunochemical test or the FIT test. This test checks for hidden blood in the stool, which can be a sign of colon polyps or cancer. It's not very invasive, and you can actually perform it at home, which is super cool. Another option is a flexible sigmoidoscopy, which involves inserting a thin, flexible tube into the rectum to examine the lower part of the colon. Well, what are some risks and benefits of these alternatives compared to a colonoscopy? Well, the benefits of the stool-based test and that flexible sigmoidoscopy are that they are less invasive than a colonoscopy, and they do not require you going under or sedation. Stool-based tests, such as the FIT recommended earlier, are simple to perform. But they do have a higher chance than the colonoscopy of false positives, which may lead to further testing, and that might come with some anxiety. A flexible sigmoidoscopy examines only a portion of the colon, so it might miss some abnormalities higher up in your colon. However, it can still detect polyps and early stages of cancer in that lower colon. Okay, well, with that in mind, what are some risks with a colonoscopy? Well, colonoscopy is genuinely a pretty safe procedure. I've seen quite a few in some of my other rotations, and they're really chill. There are some potential risks. They are pretty rare, though. These include bleeding, infection, and complications related to you be putting under during that sedation. It also requires a thorough bowel preparation. So that's when you drink all those liquids and things come spilling out the other end, which can be a little bit inconvenient and uncomfortable for some patients. Um, Additionally, there is a very small chance of colon perforation, although it's super, super rare. I see. So, considering all my concerns that I've had, what would you recommend for me? Considering that you are 50 and you haven't had a colonoscopy, I really recommend that you go for that colonoscopy, considering the dangers that can come with undiagnosed colon cancer. But it's important to weigh both the pros and cons of each of the screening methods that I mentioned. So you do not have any risk factors. And you're overall pretty healthy, and that can all be taken into account. So although that colonoscopy is the most comprehensive screening method, can respect your decision if you choose an alternative. However, it is crucial that to note that the regular colon cancer screening is essential for early detection and prevention. If you choose an alternative, we'll need to discuss the frequency of that testing and follow up to ensure adequate surveillance. Thank you so much. I really feel like I've gotten to know a lot more about colonoscopies, and I'm almost looking forward to getting it now. No problem. Do not hesitate to reach out if you have any more questions, and we can meet together to make a really good treatment plan. Nice to meet you.